Like most primary care practitioners, you likely got into healthcare because you wanted to help people. I'm sure you found it frustrating at times feeling like the way you're paid is coming between you and the care you know is best for your patients. In the traditional payment system, you're often faced with challenges. If your patient emails you a question, you might not get paid for the time it takes you to respond. If you give a patient with complex needs the full hour they deserve and require, your payment will cover only a part of that time, and likely your waiting room will fill up in the process. Comprehensive Primary Care Plus, or CPC Plus for short, is designed to provide clinicians with the resources and flexibility to provide care in ways that will deliver the best outcomes for their patients and to pay them for achieving results and improving care. In CPC Plus, practices will receive aligned supports from Medicare and other health insurance companies, CPC Plus payer partners whose members they serve. Financial supports will not be identical across payers, but will be coordinated within the CPC Plus framework to position practices to achieve optimal health outcomes. CPC Plus is organized into two tracks based on practices' readiness to jump into the work. Practices will remain in the same track throughout the 5-year model. There are 3 payment innovations in CPC Plus, which depart from the traditional fee-for-service system and can help support patient-centered care. Here's how each of these work to support comprehensive primary care in your practice. First, the CPC Plus Care Management Fee is designed to augment staffing and training to enhance practices' care management and care coordination activities. Practices have flexibility to invest it in ways that meet the needs of their patient population. CMS assigns a risk score to each Medicare beneficiary who has received the plurality of their primary care at the practice over the last 2 years. That risk score determines the amount each practice receives in care management fees. In Track 1, there are 4 different risk tiers, with payments between $6 and $30, averaging $15 per beneficiary per month. And in Track 2, there are 5 different risk tiers with an average of $28 per beneficiary per month. The Track 2 average is higher because it includes a payment of $100 for the most complex patients to support the significant needs of this population. The payments will be made by Medicare at the beginning of each quarter without any cost sharing to your patients. Second, all practices in CPC Plus will receive an upfront performance-based incentive payment. Based on their performance during the year on quality and utilization measures, they will be able to retain all or a portion of that payment. Quality performance will be assessed based on electronic clinical quality measures recorded in the EHR at the point of care and reported to CMS, as well as on patient experience of care as determined by surveys fielded by CMS. The utilization component of the incentive payment will be based on measures within primary care's control that drive total cost of care, such as inpatient admissions and ED visits. The incentive payment is $2.50 per beneficiary per month in Track 1 and $4 per beneficiary per month in Track 2. Performance is evaluated and payment is made at the practice level, so CPC Plus practices will reap directly the benefits of their efforts to improve the quality of care for and reduce unnecessary utilization by their patients. Third, we talked about the shift from fee-for-service, and that's the comprehensive primary care payment that will give clinicians in Track 2 more freedom to provide care in the manner that best meets the needs of their patients. For example, if group or e-visits make sense for a patient, or if longer visits are required because of the complexity of a patient's needs, clinicians can make those choices without worrying about not getting paid for that care. Beginning in 2017, practices will receive a portion of their expected fee-for-service evaluation and management billings in an upfront payment. The portion paid upfront will increase so that by 2019, Track 2 practices will receive a roughly 50-50 split between a prepayment of their expected fee-for-service evaluation and management billings, and a subsequent commensurate reduction in their fee-for-service billings. At the end of each year, the prepaid comprehensive primary care payment amounts will be reconciled. Each practice's historical evaluation and management billings for attributed beneficiaries will be inflated by 10% to account for practices increasing their ability to meet the majority of their patients' healthcare needs. Payment methodologies can be technical and complex, and it is likely not why you entered primary care. Yet, it is important to get paid for the work you do, and CPC Plus includes 3 payment innovations that can enhance and reshape care delivery in your practice. Investment in primary care is essential for the well-being of our healthcare system. Payment in CPC Plus is designed to support practices' work to improve the care they deliver to their patients. As a CPC Plus practice, these payments will give you the resources and flexibility to provide the primary care that you were trained to deliver and your patients deserve to receive.